In this video, I want to teach you $1 million question I used to have when I was preparing for my clinical exam. Every time I see a scenario that says, take detailed history or take focused history or take additional history, I always used to be confused. And I know that most of you guys will be confused as well. So there are three types of histories usually that we will be asked in the exam. The first one is focused, the second one is detailed, third one is additional history. Okay, so let's see what focused history means. Okay, so focused history is where the examiner is telling you don't take full history, take everything that is relevant to this particular scenario. Let me give you an example. 58-year-old male John has come to you after complaining of right arm pain. He had a fall at home and he's complaining of pain in the right arm. So take focused history, ask the examiner for findings and manage the patient. Okay, in this scenario, the examiner or the person who wrote the scenario is telling you to take all the history that is relevant to that particular scenario. You can say focused history or relevant history. Okay, so in this patient who has a pain in the right arm, what is it important? How was this fall? Was it a mechanical fall, or did he trip over something, or did someone hit him with something on the arm? So you should know the mechanism of injury. Then after he had a fall, you should rule out if he has any risk factors for fractures. That's focused. Then third thing, if someone had a fall, then you need to see if he's on any blood thinning medications, because there might be severe bleeding happening there. So you need to ask about that. Then you need to ask about things like diabetes to see how his healing mechanisms are. Someone with diabetes will heal slowly. Then you need to ask about symptoms in the arm, because if he has ruptured his brachial artery or any other main artery or blood vessel, then probably he might have some tingling, numbness and funny feeling in the hand. So these are the main things I would be focusing on, apart from all the other history. Are you on any other medications? I will be very specific. I will ask the patient, are you on any blood thinning medications? I'll be very focused. I will not beat around the bush saying, are you on any blood pressure medications, or are you on any Panadol? For me it doesn't matter, because for me, I want to know if this patient has something that needs to be fixed now. Okay, so how did the mechanism happen? Was it because he had some visual problems? Because you need to fix that problem as well. If you're not fixing the cause for the fall, that means that he might get more and more falls. So you need to rule out that. And I will ask about social history as well. Whom does he live with? It's very important, because if this patient is living alone and if he is having some risk factors, like for example, if he's taking too much alcohol and he had a fall, see, that's a risk factor. You need to ask that. So alcohol history is risk factor. But in this patient, you don't need to ask about smoking history and things like that, which are probably not that relevant. But so now you got what focused history is, and this is how you need to focus, rule out things that are relevant to your case and ignore the other things. The second one is detailed history. Detailed history is what we usually were taught in medical schools. Like you take history of presenting complaint, past history. In past history, you ask about medications, hospitalizations. Then you ask about allergies, family history, social history, and then you move on to examination. This is the common history taking we were all taught in medical schools. So in such scenarios, because just taking detailed history will take easily 5 to 6 minutes. So the scenario might be framed like this. 58-year-old John has come to you complaining of shortness of breath. Take detailed history and explain the management based on what you obtained in the history, or ask the examiner for findings and explain the management to the patient. Because see, when you're taking detailed history, it will easily take away 5 to 6 minutes of your time, sometimes 3 to 4 minutes, depending on how what the patient is telling, what the complaint is, and things like that. But easily 3 to 6 minutes. So in the last 2 minutes, the examiner will make your life easy by saying, as the examiner for findings, where they will be straightforward, or they might say something like this: take detailed history and explain 4 differential diagnoses to the examiner, or discuss the differentials with the patient. Okay, so based on what you got in that 6 minutes, you have to explain everything to the examiner or to the patient in the last 2 minutes. So that's when the scenario will be framed about detailed history. The third one is additional history. Okay, so they might say, 53-year-old female Sandra has come to you. She's a known diabetic. Your tasks are, take additional history, examine the lower limb. Okay, so this patient, this is one of the common scenarios that you see. Okay, so this patient, you don't need to actually take complete history about other things. All you need to take additional history about diabetes. Okay, when was she diagnosed? What medications is she on? Then, is she seeing an endocrinologist? Is she taking her medication regularly? Does she have any red flags of diabetes? So I hope you got this. This is very, very important. Read the scenario properly and make sure you ask the relevant history, because if you're taking irrelevant history, that means you're wasting your valuable time in the exam, and you are most likely telling the examiner, fail me, because you're wasting your time. And if you waste your time, if you don't finish all your tasks, you're most probably failing that particular station. So make sure when you're practicing doing role plays, keep all these things in mind, and make sure you read the scenario properly, and you will not have any dramas in your exam.